not only is this of benefit to you as the individual, as somebody who's working in healthcare, particularly in the sort of procurement professional area, but also from an organisational perspective as well. And we're very much looking that after we've done our sort of in-country diagnostic pieces, that we will be in a position to share out and disseminate across our sort of target areas through this programme some of those lessons learned, sharing some of the good practice, what's working well in Kenya, we want to talk about that, what's working well in Nigeria, we want to talk about that. So it's very much thinking about how can we share what's working well, how can we also share some of the stuff that's not working quite so well, and how can we learn from that as individuals and organisations as well. So yeah, please come along and have a look, ask any questions. We're both here today to answer any questions you may have. Thank you.
Thank you, Paula, and I just want to emphasize the fact that as much as we are working with the two counties and KEMSA, we are appealing to all procurement professionals and even non-procurement professionals involved in this, the procurement of pharmaceuticals, medical equipment, and medical supplies. Please register on this important platform so that, like Paula said, you can also learn from what other people are doing in other parts of the continent. So please feel free, reach out. I've shown you how to register. It's a very simple way, and we'll be glad to welcome you. We'll be glad to share knowledge with you. Please feel free and be confident with yourselves. Talk about anything. We have a lot of options on the platform. If you don't want to leave your name, we have options for anonymous. Anonymous contributor. So you will be able to, do everything that you want. But please remember, it's very, very important that you register so that we help our continent, we help our countries to, achieve the health objectives. Because when you help them, you are helping economic growth, and that economic growth will make all of us happy. Okay, jobs will be, created because we will be more productive, and employment will increase, and therefore income will increase, and that increment in income will mean that we will be able to afford our healthcare. So you have an opportunity. Please don't miss it.
In terms of how CIPS is helping improve healthcare procurement across Africa. I'm sure the participants online have understood. I keep saying, at least for me, I've said, if for lack of anything, you just need to go and click on the link. If you are involved in healthcare procurement or know someone who's involved in healthcare procurement, you can also encourage them to go and click on the link and self-register, and then improve their own competence, capability, and also improve the organizational capability. So thank you very much for that. We have one question now, but I'll ask participants if you have any question right now, if you can also just post it in the Q&A. I think Nas Dlamini, I hope I've pronounced that right. She says she needs it more than everything for her country. The name sounds like it's from South Africa, but if you could also just advise Nas Dlamini where you're based, maybe it would be great to see that. But then obviously, if you can then just go online. Oh, you're from Swaziland. Excellent. Thank you so much for posting. If you can also just go online and click on the healthprocurementafrica.org and register yourself. I'm sure someone will get in touch with you, and then you can progress the conversation in terms of how to benefit yourself and benefit your organization and your country.
Yeah, I think Marianne, you've answered her well. While I'm based in Kenya, on this slide that I shared, we have a website there, www.healthprocurementafrica.org. Once you log in there as following the access methodology that you are shown, you will meet us there. I'm one of the community managers on the platform, and we have three or four others. So you'll be very, very much welcome, and you'll find a lot of your colleagues there from Swaziland, maybe from South Africa, and Like you see, there's an open forum here which has 770 members. So you'll be surprised that some of your colleagues are already there. So please feel welcome. Again, visit the website and we will let you in.
Thank you, Gessa. I think we'll just give a few more minutes and see if anybody has any other question. In the meantime, I was writing down some notes. Oh, excellent. So someone, Austin Kitinya from Kenya, he's asking, how does the program benefit procurement practice from private organizations?
Yeah, so procurement in the private sector is slightly different from that of the public sector, but the principles are the same. Only the environments and objectives are different. So still, if you follow our study materials, if you follow even SIPS, even becoming a SIPS member, will be a very good start for you to understand and enjoy the benefits of some of these processes, procurement policies and practices. But for us, of course, while we are targeting public sector, we know that the public sector depends on the private sector, for supplies. So it cuts across. It's actually a cross germination of ideas. So while we mention public sector, but the principles can benefit and the practices can benefit even the private sector. For example, let me give you an example of the total cost of ownership. If you can apply that model in your private sector organization, where you prove to your organization that you are looking at the entire cost model, okay, starting from the procurement, the acquisition cost, all through to the distribution, delivery, storage, maintenance, disposal, in a way that your organization will see value, then you'll be positioning yourself very well in your private sector organization. The same thing applies to strategic model that I mentioned. If you can be able to segment your market and identify which are the bottleneck items, the things that really make it very hard for me to achieve my procurement objectives, and then work around it, develop strategies around it, that will again position you as a procurement professional in the private sector. The same thing goes to the strategic items, being able to form collaborations with your suppliers, and this can happen both at the private sector and the public sector. Because our suppliers just identify what are some of the key procurement items that I buy for organizations that are mission critical, that can break or make the organization. Once you identify that, you work around with the organization, with your other members of the organization, finance, user departments, to develop strategies that will overcome or will improve that kind of procurement. And we talk about cross-functional team working. If you can work with your organization, and this cross-functional team working are some of the ideas, some of the practices that we encourage as SIPS and we encourage again on this committee of practice. So it's the models, the ideas, the practices cut across the sector divide. I don't know if that satisfies you,